And now, without any further ado, we would like to call upon our keynote speaker to kickstart these sessions for NPC, Dr. RS Sharma. He doesn't need any introduction. He is the CEO, and he's now the CEO at the National Health Authority, and is responsible for managing the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. I would like to now request Dr. RS Sharma to please come on the stage and address all the attendees who have joined us. Over to you, sir.
Well, good morning, everybody, and thank you very much, Shreya and Ram Kumar ji, for starting this conclave. I am really thankful to NESCOM for inviting me to this product conclave, which has become one of the largest platforms for showcasing Indian products and startups, which are transforming not only India but also have the capability and potential to transform the world. Now, I want to, put a context as to why products are possible and what kind of architecture India has put into place, which enables the development of the products, but in a way which is actually not silos. It's not a silo development of the products, but it is actually an orchestrated development in a way that the government provides the framework and then enables innovations on top of those frameworks. That has been our journey in the last about 1 decade or more than 1 decade. And this is the journey which continues. And today I'd like to speak to you on the digital health. Now, typically, when you add something digital to any domain, digital seems to acquire more prominence than the domain. But I want to very clearly stipulate and articulate that, look, digital is only an enabler. The real stuff is health. Similarly, you had e-governance, and E was only the enabler, and the governance was the real, meat in the whole story. So therefore, digital is an enabler for providing more affordable, more accessible, more quality health services. And that is what is the aim of what we call Ayushman Bharat Digital Mission, which was launched by our Honorable Prime Minister in September of 2021 and has completed just 1 year. We had about 2 weeks back Arogya Manthan, a conclave of all stakeholders, where we delved into various issues relating to digital health and also how we can actually accelerate and roll out larger coverage of the Ayushman Bharat PMJY. So there are certain, characteristics of digital which actually make it a very, very important enabler. One is that it collapses distance. Now, in context of a digital health services delivery, if I don't have to visit a hospital every time, even for follow-up visits and otherwise, then, my cost goes down. And if I can do that without traveling and without actually making accommodation arrangements in dharamsalas, in big hospitals, and I'm talking about a poor person, then, it makes it much more affordable. Video consultation, for example, is one such technology which enables patients and doctors to communicate with each other, even at a distance, like we are communicating with you all today. Now, digital also eliminates paper. Otherwise I have to carry the whole bag of documents, X-rays, etc., etc. If these documents are digital, then, it eliminates that, and it eliminates also the fear of losing out some of the documents. Typically, you find that when a poor person is sitting in front of the doctor and doctor says that, show me the X-ray which you had last time, or show me the blood report, and the person just fumbles and, in that moment of nervousness, he or she is not able to figure out and find out what the documents are. Similarly, digital is cost effective, and also one more important thing is the transformation of information. The transfer of information becomes very easy. So for example, if I am communicating on a video consultation with my doctor, and then, he calls an expert, then that expert immediately I can transfer or that expert also has a visibility into my, diagnostic reports and other kinds of things. So I think use of digital technology, leverage in digital technology makes the health service provisioning, if you do it in a right way, then it makes health service provisioning much more cost effective, affordable, quality wise, and also accessible, because then a person from remote area can also consult a doctor in a metropolitan. So this is one part. Now, typically, you must have seen, all of you, that during the COVID times, digital was the only positive outcome of that COVID. Otherwise, it was a disaster throughout the whole world, including our own country. So we, learned, talking on telephone to our doctors, talking on video, calls with our doctors, and therefore technology, the digital was accelerated. But that acceleration was only fragmented. There were WhatsApp groups, or there are other kinds of groups which essentially started using digital technology. What the Ayushman Bharat Digital Mission does is essentially create a framework where all these small solutions, all these solutions which are being developed, the products which are being developed, become a part of a larger, framework, and therefore are able to communicate with each other. Otherwise, typically product development in any sector takes place in a manner that, the product developer makes arrangements for doctors, for example, in the health, doctors, laboratories, hospitals, patients, onboarding patients, downloading applications, etc. So it all is self-contained, and that self-contained has typically, being called the silos development. And that is not really good for as large a country and as diverse a country as ours. And therefore, the whole approach of ours is completely standard-based, open API-based, interoperable-based. These are some of the attributes which we are having for our products. Now, you might ask, everybody, all the European countries or the Americans have done, they have been doing digital health for a long time. Why don't you just follow what those guys have done? Now, what we want to tell you is that what we are doing is completely unique and different. Why it is unique and different, I just want to explain to you in the next 1 minute. One is that we have created certain digital public goods, what is being called as public digital infrastructure in the heading of your NESCOM product conclave. So essentially, we have created digital public goods. Now, what are these? One is digital identity. Now, digital identity, that is Aadhaar, enables plugging of this identity, proving your identity in any transaction. And that's a great enabler, because now when I am on a video consult, I don't have to prove that I am me, which may mean because I have a digital identity which I can use to prove myself as to who I am. Similarly, the doctors also have a digital identity. So I think that solves a lot of problems. Similarly, we have created digital payment system, which is again interoperable and universal and frugal and free. So when I consult a doctor and I pay a doctor at the end of the consultation, I am basically able to digitally pay him in a very, very hassle-free and seamless manner. So that's another digital public good which we have developed. And on top of this identity and payment, we have developed what is called JAM, Janadhan Aadhaar and Mobile, which has made almost 82% of Indians have now a bank account or some financial address, some financial receptacle. Now that also makes it possible for us to have digital conversations where I can pay from my account. So India is highly financially included in a limited sense, of course, limited sense of having a bank account. That has happened. Similarly, we have created other digital infrastructures like electronic KYC, authentication, electronic consent artifact. We have created what is called digital locker, and a number of things have been created which actually enable storage of records, giving consent digitally, ensuring we are able to pay and all those things. So that is the framework, and that is why we feel using these digital public infrastructure, it becomes easy to transact things in a very in almost all domains in a digital manner. Transactions become easy. Now the question is, one may ask the question. Typically, government should keep out of these innovations and other kinds of things, because wherever government goes, things don't happen. Typically, that's the complaint. But let me also say that why government is coming into this play. The government is coming into this play because government only has the, the sort of overall architecture principle in mind, and government only can create larger frameworks which are interoperable. Otherwise, if left to XYZ company, they will create solutions which actually, and rightly so, which will give them the space and will increase them. They can create an Amazon, they can create other kinds of solutions which ultimately collapse into a monopoly. So essentially, we are creating a democratic framework which will enable easy access and easy innovations on top of it. This is what we did in digital identity space. We did not create solutions. We did not create products. We basically said, this is a framework on which you can create products. So you are now creating a banking application which uses Aadhaar as a digital identity proof. So similarly, all kinds of applications can use these frameworks to create interoperable solutions. So therefore, what happens is when you create a product, that product creation becomes easy because you don't have to create all components of that ecosystem. You just have to create a product in a limited area. But then because your product can be plugged into a framework, therefore your product becomes interoperable and visible to everybody. That's how we are creating. So this is the reason why a number of digital public infrastructures are being used in a beautiful manner. Let's take an example of COVID. Now, the addition of COVID to this list of digital public infrastructure with over 2 billion doses administered and over 1 billion registered people shows that now healthcare is ready to be digitized and revolutionized. Taking a leaf out of the success mantra of these interoperable digital public goods, we have created a digital health protocol under the Ayushman Bharat digital mission called Unified Health Interface. This is similar to unified payment interface, whereby you can pay any bank to any bank to any wallet, person to person, account to account, all kinds of things are enabled. And now you can even have call collect type of situation where you can have payment collect, which is possible. So this is the basic principle of creating the unified health interface. And UHI is one of the foundational layers in the ABDM that focuses on the discoverability and delivery of health services. It's an integral part of the ABDM ecosystem that interacts with the digital registries developed in ABDM to provide verified and trusted services to the users. So another thing which the government can do in a very easy manner and in a very trusted manner is the creation of registries. So government provides licenses to the hospitals and other kinds of the entities in the system. So therefore, registry of laboratories, registry of hospitals, similarly registry of doctors, health professionals, these, and registry of drugs, for example, these are some of the trusted registries which can be leveraged by the startups who are basically developing solutions. So essentially, the ABDM provides verified and trusted services to the user. Similarly, the role played by UPI, similar to the role played by UPI, UHI breaks the existing siloed digital health platforms and creates values for all these stakeholders with interoperability built at its core. The patients can freely access healthcare services without any commercial biases, and the doctors have opportunity to provide their services to a larger population without any gatekeepers restricting them. All this is being enabled while digital players find innovative ways to leverage the digital public infrastructure built by ABDM to provide quality services to the patient. UHI will enable a qualified professional to provide teleconsultations without the need to subscribe to multiple platforms, which means he just has to install one teleconsult application, and they will be able to talk to any teleconsult application which the patient might have. While the UPI revolutionized payments and transactions in India with its secure and easy interface benefiting all the stakeholders in the process, UHI will revolutionize digital health services delivery in India, In our efforts to bring the digital health ecosystem together, we conducted a hackathon in the month of July of this year with the help of NASSCOM, where various teams of innovators, developers, and data experts joined to collaborate and build innovative solutions. The aim of this hackathon series was to mobilize the health startup ecosystem in India by bringing together individuals and organizations to develop innovative solutions. Healthcare in India is currently at an inflection point, and UHI is expected to be a game changer in the way digital health services are discovered and accessed going forward. With discoverability and transparency at the core of UHI, this will mean that emerging startups as well as established companies can benefit from greater market access, reduced user acquisition, cost, and increased operational efficiency. Further, UHI facilitates the ease of doing business to the healthcare service providers by granting them access to a large number of users through the medium of a common platform. This paradigm shift in healthcare delivery also gives rise to a sea of opportunities for the emerging health tech ecosystem. A rapidly evolving digital health sector allows for more innovations and emergence of new services in digital health that have not been possible before. I'm certain that startups as well as large companies can become a part of this increasing pie and contribute to India's digital health journey. Through this platform, I urge all of the participants here to participate because it is going to be an extremely vibrant, interoperable, frugal, standard-based platform which is going to serve the entire population of India, as diverse as our country is. It is going to serve them all. Thank you very much once again for inviting me to this conclave. Thank you.
Thank you, Dr. RS Sharma, for that lovely keynote and setting the context. Some of the things that you pointed out couldn't be right. So thank you so much for that very inspiring keynote session.